Now, this is a very, very interesting issue that we can see. You can simply pause the video and you can try to figure out what is the abnormality in this ECG. Now, when we see this ECG, what we can simply notice, the heart rate is very high. The heart rate it is showing is 251. Now it is very easy to calculate heart rate. It is just 300 divided by number of large squares between the two R waves. This is R wave, this is R wave, this is R wave, this is R wave. So you can simply see that the large box, it is one box and it is half box. So it means ki it is around one and a half box which is there. So obviously the heart rate it is coming which is around 200. If you see it is same one box and half box here. If you see here it is one large box means small five boxes. So here the heart rate is coming around 300. So the heart rate is around 300 to 200. So this is very much tachycardia. This looks like a narrow QRS complex tachycardia. You can see that the QRS, there is hardly one or one and a half small squares. We call it as wide QRS complex tachycardia if it is more than three small squares, because one small square is around 0.04 second. So more than 3 means 0.12 seconds. So in here basically the it is narrow QRS complex tachycardia and heart rate is around more than 200. Now the most important thing you should have in habit, any ECG, the first thing that we should calculate is to see whether this ECG is showing normal rhythm or not, whether the rhythm is constant or not. This is the most important question. That has to be the first question always. So it's very easy to come to know whether this is the rhythm is regular or not. To call it it's a regular rhythm, the number of small squares between the two RR must be almost constant, and that should be repeated in a particular lead. For suppose lead 1, the small number of small square should be almost always constant. Now let us calculate. Here it is 1 2 3 4, 4.5. Here it is 1 2 3 4. So here it is 4.5. It is 1 2 3 4 5 6 7 8 9. So there are 9 box here. 1 2 3 4 5 6 7. There are 7 box. There is 1 2 3 4 5. There is 5. There is 1 2 3 4 5 6 7 8 8. So there is 1 2 3 4 5 6 around 6.5. So each and every beat, they are all irregular. I mean, there is no actual constant gap between the two. You can calculate the same thing in any other particular lead. You simply have to take number of small square in between the two RR. Usually it should be more of a normal or constant. Or if there is sinus arrhythmia, then it can be like number of small square can be like 5 and 7, 5 and 7, 5, 5, 5 and 7. But the number of small square should be constant. If the number of small square are not constant, it means कि this RR interval is totally varying. It means कि there is totally irregular placed heartbeats, and that is what is atrial fibrillation means. So atrial fibrillation means you'll not be able to see P wave very crystal clear. In this particular ECG, the patient's heart rate was 220, 250, it was very high. So the patient was settled very fast. So we could not take a second ECG because settling the ECG, settling the problem was much more important. So the heart rate is totally varying. The RR is varying. This is AFib. You will not see any P wave because the P means atria, they are in fibrillatory state. Fibrillatory state means the atria will not pump very effectively. They will simply be in like this fibrillatory state. So normally they should contract. they should contract like this. But in this fibrillate state, they will not contract. They will be simply like shivering. They will not effectively contract. That is the reason why you'll not see P wave. So absent P wave and varying RR interval or irregular heart rate is typical of atrial fibrillation. Now, the most important thing of this atrial fibrillation, of a new onset atrial fibrillation, is the treatment. The best treatment for this is Cardron or Amidron. Now, Amidron uh, actually acts as a node. It mainly acts at AV node, and it cut down all the impulses, and it is a very effective medicine to revert the atrial fibrillation. It can revert almost from 75 to 80% of all the AFib. So the dose is 150 milligram, and that can be given as bolus. But giving amidron bolus is very risky. If the patient has a heart failure with reduced ejection fraction, if the patient blood pressure is low, the blood pressure can fall very drastically, and patient can have hypotension and even cardiac arrest as well. So usually, always, if you have to give Cardron very fast, you can simply take the same Cardron 150 ml in 50 ml NS, or you can take it in total 50 ml NS, and you can give it slowly over a period of a minute or two. If there is no hurry, if heart rate is around between 130 to 140, if the patient is stable, if the blood pressure is good, we can give 150 milligram of Cardron in 100 ml NS over 20 to 30 minutes as well, and it can be repeated as well. So once the atrial fibrillation is settled, if it doesn't settle with Cardron 300 milligram, then you can always have diltiazem as a second option. Diltiazem come in usually 25 milligram while you can take around 10 to 20 milligram of diltiazem. You can dilute it in around 10 to 20 ml NS, and you can give the diltiazem slowly around 10 milligram of dilsem you can give over a period of a minute or two. This is also one of the excellent medicine to revert the atrial fibrillation. So for atrial fibrillation, diagnosing atrial fibrillation with irregular heartbeat, varying RR interval is very important, and this can be very highly effectively treated with amidron or dulcin. If these two things also doesn't settle, then cardron infusion or amidron infusion can be started, and as soon as the patient's heart rate is settled, the patient can be then shifted to Cardron tablet, and the starting dose of the Cardron tablet can be in between 100 to 600 milligram, depending on the individual variability, like whether patient is elderly or not. 100 milligram TDS can also be given if atrial fibrillation is a problem. Apart from that, digoxin in tablet digoxin or injection digoxin can also be used to reduce the heart rate, because digoxin significantly reduces the vagal tone, and it reduces the impulses which are generated by the SA node or the atrial pacemakers. So automatically it can increase the vagus tone, and it can also cause reduction in the heart rate. If the heart rate is very much high, injection zero point 0.5 milligram of digoxin also be given, or if the patient is stable, then zero point 0.5 milligram of digoxin tablet can be given, and it can be continued with 0.125 to 0.25 milligram of digoxin to be given every day. The half-life of the drug is very high. It acts for around 7 days. That is the reason why very commonly most of the doctors, or the many of the doctors, give this medicine for around 5 days, and they skip this medicine digoxin on Saturday and Sunday. So these drugs can 100% be used, especially digoxin is there, cardron is there, and very commonly dilzem is there. So that's for today, and thank you.